Hello everybody, here we're going to be working with Strideway today. I've got my son Owen on the far side here. He's been nice enough to help us collect some data on Strideway, the pediatric use. He actually just suffered an injury today, so we might get some limping and all that kind of stuff too that might be fun to see. So let's get started. I think I've got the software view running. And I've already calibrated the Strideway now, so we'll just go ahead and get ready to send our data. So Owen, you want to just walk over here and get the recording going. So you can see in the software here, if he walks across, you just want to go and take a quick walk across. So we can see the Footstrike as he's walking across there. And come on back. All right. Okay, so now we're going to go ahead and start the data collection. All the way to the end. And then you're going to come back. As long as you can. Go again. And one more time.
And you can see, again, green is left, red is our right foot. And we know that he's having an issue with his left foot. So you can see there's almost no forefoot propulsion going on. And his heel strike is very delayed, if there's any. So it's obvious that there's quite a big asymmetry in the force time curves in this regard. Even if you look at the pressure profiles here, you can see his left foot is not putting much weight down on the heel at all. Whereas you can see a little bit more red in this area here. So, I mean, if you're using this tool as a return to play type of tool, this would indicate someone who's clearly not ready to go back. And that, I think we can see that with the force time curves as well. So the plan here is to try and collect more data again tomorrow with Owen and the next day, and maybe we can start plotting some of this progression. So one of the first things that we notice right off the bat, I mean, we can look at the pressure profiles, right foot, left. This is before with the injury. See a little bit less pressure on the heel. If you're just looking at between the left and the right foot, and we're seeing a lot more pressure in the forefoot area, the metatarsal heads versus here. If we look at now, like what we would consider more of a healthy, well, he's healthier. The injury seems to be past. And now we see a more equal distribution in terms of how that force is, or those pressures are applied to the heel and forefoot areas of the foot. Much more symmetry between the two in terms of the color scales that we're looking at. And then if we go down and look at the force versus time curves, we can see our red curve here is our right foot, and our green, we can see quite an offset in terms of the initial phase, which would be the heel strike phase that we had here. And then our forefoot propulsive phase, where there's almost no propulsion going on. You also see a much longer delay or time to peak, if you will, on the left foot. And this is likely due to the pain, the injury, spending a lot more time loading the foot, and maybe that heel is just not coming off the ground because of the injury itself. It just doesn't look the same as it normally would, obviously, and that's what we'd expect with an injury. Now, if we look over here and look at the same heel area, we can see the green and the red curves following each other almost identically and arriving at peak pretty much at the same time, and then going through the mid-stance phase and the forefoot propulsive phase with very similar curvatures. So we can definitely see a change in terms of an injured player and then now an uninjured child, if you will. If you're looking at this from a standpoint of when they can get back to sports, or if they're things like that, this could be a good way to try and determine how the child is progressing in terms of their rehab.